we will discuss about the terminologies which can be used in the modules, like the infectivity means the ability to infect a host, pathogenicity is ability to cause a disease in the host, virulence is the ability to cause severe disease in the host, and immunogenicity is the ability to induce an immune response in the host. So, if the infectivity, if you see, some of the bacteria or the viruses, they are very virulent, and their course of illness will be very fast, and they will not give enough time even to give the proper antibiotics or antivirals, and the patient may have a very severe morbidity and mortality. So, how the body responds to this infection is called as an immunogenicity. If you see the infectious disease terminologies here, the infective doses, infectious dose is a number of organisms needed to successfully infect the latent period exposure to infectiousness interval. Infectious dose is nothing but the dose of the viruses which can cause a clinical signs and the symptoms, and incubation period is the interval from exposure to the clinical symptoms. Once it is a time interval between the exposure of the person and the first appearance of the signs and symptoms. Infectious period is the interval during which host can transmit infections. Most of the viral infections are infectious, like if you see the influenza viruses, the patient remain infectious to other persons in the surroundings for 5 to 6 days after the start of the onset of the illness. Even for if you see the mumps, measles, chickenpox, varicella zoster and all, the patient becomes infectious 1 or 2 days before the onset of the clinical signs and symptoms to the remission of the lesions on the body. So, this is what the infectious period is very important. Whenever we are dealing with any microorganisms, we need to know the infectious period and their infectivity time. The reproductivity rate again is an ability of an agent to spread in populations. Like as just now we discussed about the virulence, many of the bacteria and the viruses can be very virulent, and some of them may be less virulent. And outbreak is nothing but again the appearance of a new spurt of an infections in the community above the expected level or the expected their population, and this is usually it could be an epidemic or it could be an endemic, or it could sometime be an endemic pandemic as well. Epidemics, as like we have seen recently outbreaks in Kerala, outbreaks in even in Hyderabad. If you see, we have an epidemic of H1N1 here, with so many of H1N1 positive patients being treated in the hospitals. That is a typical epidemic. Endemic is nothing but usually it presents in the given period in a population, and it is the baseline of the infection which is present in the community. It is called as an endemic. Whenever the figure goes beyond the expected infection in the given time period, it is termed as an epidemic. The important terms, if you see apart from that which is used in the study of the infectious diseases, is the bacteremia. It is nothing but again the bacteria circulating in the bloodstream. The colonization is a very important. If you ask me the terminology, it is nothing but an establishment and growth of a microorganism on a body surface. Whenever we say the colonizers means it stays on the body symbiotically without causing any damage to the body, and it is in fact friendly flora for the body which helps in maintaining the metabolism in the bodies. If you see the immunocompromised, as we discussed in detail about the immunocompromised conditions and infectious diseases. Latent infections is an infection in which the infectious agent is present, but not active. That is again the latent infection. It could be the typical one could be varicella zoster, which may remain latent for decades in the body, and also some of the viruses like HIV, hepatitis B and hepatitis C viruses, which are latent, and once they become active or replicate, the infection starts. Till that time the patients are usually the carriers. And apart from that, if you see the pathogen, any disease causing microorganisms or viruses are called as a pathogen. They are not the normal microflora of the body. They are the pathogens which can cause infections and produce disease in the body. Primary infection is an infection in first time in a previously healthy person. It is termed as a primary infection. Secondary infection is an additional infection that occurs as a result of primary infection, where the patient is already having an infection in the form of, like example, the patient is having pneumonia and being treated for the community acquired pneumonia, but during the course of treatment in the hospital, because of the long length of stay of the different antibiotics and immunocompromised condition, the patient may develop the secondary infections, like the infection with a new microorganisms either at the same site or at a different site. Coming to the toxemia, again it is a toxin circulating the bloodstream infections. Viremia is again the viruses circulating in the bloodstream infections. So, these are the terminologies which we use very commonly whenever we speak about the infection prevention and control. Coming to the next slide about the modes of transmission, these are the basic definitions which we have seen now. Now, if you see the next slide, in this the modes of transmissions, where again the different modes of transmissions, the direct and indirect. In the coming modules, we will discuss in detail about the standard precautions and the transmission based precautions, where we also cover the airborne and the droplet infections. And in this, if you see the microorganisms, what are the different modes of transmission. The droplet infections, when we say, it could be Neisseria meningitidis or diphtheria or Bordetella pertussis, measles, which can become a droplet infections. Aerolized infections are again the airborne infections, which are mainly tuberculosis or varicella pneumoniae. This type of infections where they generate the droplets, and these droplets can go for a longer distance, and they have less than 0.5 micrometers in size. So, this could travel to a larger distance when compared to the droplet infections, which could travel only 2 or 3 feet, and it could fall due to the gravity. Indirect, again it is a very important modes of transmission through fomites, like cloths, blankets, door handles, commonly touching objects like your phone receiver, computer keyboard, computer mouse keys, and these are the places where the being frequently touched. And also indirect could be through vectors like mosquitoes, if you see again the malaria and the dengue infections which caused by Aedes aegypti. So, these are the infections which can travel through vectors. And again food and water is a very important talk. Believe me, water plays a very important role in the hospitals. If the water gets infected, the variety of infections like the Legionella infections, and you can have so many waterborne infections. So, that is where the engineering control plays a very important role in the hospital. And the environmental control in the hospital, and also taking care of the water and the food and the water is very important. Coming to the next slide about the clinical transmission of infections by an agent. If you see here in the inapparent infections, the clinical responses to the infection by an agent. Inapparent infection, where when we have started this talk, initially I told some of the infections may go inapparent, where the patient will not have any clinical signs and symptoms, but some of them may become a carrier with no clinical symptoms, but host can transmit infections for long period. Example, if you see the salmonella infection, the typhoid, once the patient get treated, even after complete remission of the treatment, the patient could become a carrier for salmonella for a long time, and there is fair possibility and chances that he can infect others if there is no proper hand hygienic conditions. The salmonella can transfer in the stool for a long time. And similarly, if you see the HBsAg, hepatitis B virus and hepatitis C virus, they could be carriers where the patient may not have acute infection. A patient looks apparently absolutely normal, and the patient does not have any problem, but when we test incidentally it comes out to be positive for hepatitis B or hepatitis C, and when we do subsequent workup in that type of patients, then the other things will come negative, like hepatitis envelope antigen come negative, and the patient may not be in a acute replication, and this type of patients will be a carrier where they do not carry any acute symptoms, clinical symptoms, but they could be a carrier and there are chances of infections to others. Coming to the clinical symptoms, where we come across day in and out, the patient may come with a mild disease, or the patient may come with a severe disease, and sometimes the residual impairment and even the mortality. So, this type of cases where the response to the infection by agent, again if you see here, it depends on the immunity of the patient and how virulent is the organism and it is causing damage to the patient, and also the supportive conditions which the patient is having. So, all these factors are very important. When we discuss about the microorganisms or hospital acquired infections, each and everything is important. If you see here in the hospital acquired infection, the microorganisms, the host whose immunity is very important, and environment of the hospital which is causing the loads of microorganisms which get exposed to day in and out so many antibiotics and they become resistant, and also the infection control and prevention practices in the hospital, how the healthcare providers, not only the doctors and the nursing staff, but also the housekeeping staff, how they are taking care of the infection prevention and control, how the policies have been designed, how the procedures have been implemented, whether the hand hygiene is in place, biomedical waste segregation is in place. So many factors are important, especially if you see the cleaning aspect in the ICUs, high risk areas, the cleaning and disinfection of your bed rails, your equipment surrounding the bed, all these things plays a very important role, and ultimately if you see all these things, that will give rise to the clinical response the patient can get with an infection, and what will be the outcome of the patient once they get exposed to this type of environment.